Many times the disorder is complex. It's not as simple as one single thing.
The population of people with developmental disabilities is very diverse. It includes a long list of diagnostic categories, birth accident, genetic conditions, behavioral disorders.
Definitions vary, but generally include individuals 5 years or older with severe mental and/or physical impairment likely to continue indefinitely and manifesting by age 22. Children under 5 with delay in development are included, where a condition without intervention is likely to result in longer-range disabilities. The condition must substantially limit 3 or more areas: self-care, receptive and expressive language, learning, mobility, self-direction, capacity for independent living, or economic self-sufficiency.
The kids grow up into adults and need assistance from the community and the medical system.
Where would you like to sit, in a chair?
Transitioning from pediatric to adult providers can be particularly difficult because few adult providers have developmental disability expertise. As a result, young adults are often underserved by health care. Inadequate training for providers is one reason why people with developmental disabilities struggle to find effective health care. Another reason is that people with developmental disabilities are often uninsured or underinsured. They can require more time to interact with, which, of course, is difficult for healthcare professionals who are already squeezed for time.
Will I have enough time in a visit? There are certainly concerns about reimbursement. If I don't get reimbursed, I can't keep the office open, so I can't serve anybody.
Sometimes people with developmental disorders will have exclusions in their insurance coverage, or sometimes they may not meet the criteria fully to be covered by state programs. Sometimes some of their symptoms will fall into a mental health category. Other times they'll fall into a developmental disorder category. And if you have both, sometimes you're in between and neither side may fully own you or take you.
Another reason people with developmental disabilities may not get effective care is that healthcare professionals, like the general population, often harbor stereotypes.
We all grew up in a society that considers people with developmental disabilities to be burdensome and scary. You know, images like Quasimodo and Frankenstein. Medical providers are not immune from these stereotypes.
Sometimes physicians, they go to school to maybe wanting to help and heal kind of healthy, perfect humans. And when something isn't perfect, it's something they maybe don't want to deal with.
I remember when I was a medical student, and the first time I went to a regional center that had people that were very disturbed. And it bothered me at first until I spent some time kind of getting to know the people and see the way that they could interact and watch people who were compassionate caretakers approach them in those ways. And after a while I went and it just felt like home. It was fine.
To get past stereotypes they may harbor, healthcare professionals should realize that people with developmental disabilities often have the same hopes and dreams as anyone else.
And a lot of doctors have this unbelievable misconception that people with disabilities don't have lives. They don't do things. They just live from check to check. They watch TV all day. And there's so much more to life than that. I want to have a family and get married. And buy a car and a house. In 2005, I started a home care agency to help people with disabilities. I go to work every day at 9 o'clock. And sometimes I don't get out of work till 6. My days are full.